Let's cover the autism spectrum disorder within the context of the physiological psychology domain. The DSM-5 reports frequencies of autism spectrum disorder at about 1% of the population. Why rates have been increasing is unknown. This diagnosis is more prevalent in boys than in girls, with a gender ratio of about 4:1 males to females. A number of genetic, environmental, and genetic X environmental variables have been identified as possible factors that contribute to the etiology of autistic disorder. However, research has not yet identified a definitive etiological mechanism. Children who are diagnosed with autism spectrum disorder show impaired social interactions, communication deficits, and repetitive or stereotype behavior. Children may be diagnosed with autism spectrum disorder as early as 24 months, although some symptoms may be observable before 12 months of age, depending on the severity of the symptoms themselves. Children with autism spectrum disorder struggle with social interactions and demonstrate difficulties communicating with others. Language abilities are often severely delayed as well. Individuals with autism may echo what is said to them, a phenomenon called echolalia. Paralalia, which is the repetition of one's own words, also occurs in autism. However, this is less common than echolalia. Abstract thinking is generally impaired, and individuals with autism often interpret information in a rigidly concrete, literal manner. Individuals with autism vary widely in their intellectual abilities, ranging from severely impaired to exceptionally gifted. Some individuals with autism spectrum disorder who learn to communicate reasonably well often engage in conversations regarding their stereotyped interests. Individuals with autism may repeat body movements, including engaging in aggressive or self-injurious behaviors. They have restricted intellectual interests in one particular category, for example, insects. They may also become fascinated with specific objects or movements and may engage in these to the exclusion of everything else. Current research has robustly demonstrated that social impairments observed in autism spectrum disorder are associated with abnormal activity in the fusiform gyrus, located in the ventral temporal lobe, and the amygdala. Together, these brain regions have shown to be involved in a network that fosters the development of face recognition and the emotional salience involved in facial recognition and social interactions. The causal direction, however, of this research continues to remain unknown. Well, let's practice with a question for autistic spectrum disorder in this physiological psychology domain. Ashley, a young girl who is 6 years old and diagnosed with autism, continually repeats certain words. Based upon her behavior, it is more than likely that Ashley has answer A, echolalia, answer B, speech sound disorders, C, Rett's syndrome, or D, palalalia. The correct answer is D, palalalia, which is a repetition of one's own words. Echolalia is when an individual with autism echoes what is said to them, which makes answer A incorrect. Speech sound disorder, answer B, involves persistent difficulty with speech sound production that interferes with verbal communication. Individuals with Rett's syndrome demonstrate impaired social interactions, but these impairments are only transient. Rett's disorder is also associated with head growth deceleration and poor coordination, making answer C incorrect.